Hello, Dan. It's good to see you again. How have you been since our last session?
Hi, Elizabeth. I've been trying to apply what we discussed. I started taking short breaks during work and try to stop checking my emails after 8 p.m. It's been a bit tough, but I've noticed I'm sleeping slightly better.
That's wonderful progress, Gan. Small steps make a big difference over time. Today, I'd like to talk about something called mental health first aid. Have you heard of it before?
I've heard the term, but I'm not sure what it really means.
Mental health first aid, or MHFA, is just like physical first aid, but for the mind. It's a set of practical skills and understanding that helps you recognize the early signs of mental health challenges in yourself or others and respond in a supportive way.
That sounds interesting. So it's about noticing when something is wrong mentally?
Exactly. It's about awareness and early action. For example, if you notice persistent tiredness, irritability, lack of motivation, or difficulty concentrating, those could be early signs of stress, anxiety, or burnout. Recognizing them early helps prevent things from getting worse.
That makes sense. I think I ignored those signs for months before realizing how bad it got.
And that's very common, Dan. Most people push through thinking they just need to work harder. But MHFA teaches us to pause, check in, and respond. The key steps often include recognize the signs of mental distress, listen non-judgmentally to yourself or someone else, provide reassurance and support, encourage professional help if needed, encourage self-care and positive coping strategies.
I like that it starts with listening. I've noticed I'm not very kind to myself when I feel down. I usually just tell myself to snap out of it.
That's a powerful insight, Dan. Mental health first aid begins with self-compassion. Instead of criticizing yourself, try saying, I'm feeling overwhelmed right now, and that's okay. I need a moment to rest. It's about treating yourself like you would treat a close friend.
That's a different way to think. I usually don't give myself that kind of permission.
Many people don't, but when you learn to respond to your own needs with understanding instead of judgment, you recover faster and handle stress better. MHFA also means knowing when to reach out to a colleague, friend, or professional before things get too heavy.
I see. So it's not just for helping others, but also for managing my own mental health.
Absolutely. It's both. In your case, as a supervisor, it can be especially helpful. You can support your team members if you notice they're struggling by listening and guiding them toward help. That not only helps them, but it also builds a healthier work culture.
That's a great point. I think some of my team members have been showing signs of stress lately, too. Maybe I can use some of these steps with them.
That's the spirit, Dan. Start by checking in with them casually. Something simple like, hey, how are you managing with all the workload? Listening without judging or trying to fix them right away often makes people feel seen and supported.
I'll definitely try that. It feels good to have practical ways to handle things now.
I'm glad to hear that. For this week, I want you to practice self-first aid. That means noticing how you feel throughout the day and responding gently when you sense stress or fatigue. We'll discuss what you learn in our next session.
Sounds good, Elizabeth. Thank you for guiding me through this. It's starting to make a lot of sense now.
You're doing great, Dan. Remember, mental health care starts with awareness and compassion, both for yourself and others. Keep practicing, and you'll see more balance and calm over time.
I'll do that. Thanks again, Elizabeth. See you next week.
Take care, Dan. And remember, being kind to your mind is the first step toward healing.